years, okay? And here's the thing about Japan. In Japan, if you got the sniffles, you learn this when you're 5 years old, right? You wear a mask. Absolutely.
Hello there, and welcome to the golf club.
To somebody else. And a lot
Just
of people
starting
wear
off on
masks
this
when they get on
lovely
the subway,
par
so
4.
they don't catch somebody's COVID, right? I was looking at the statistics. In America, USA, as of today, CDC statistics, we have 239,279 cases of the virus, 5,443 deaths. That's the last time I looked at my computer.
Solid swing.
Japan, 2,834 confirmed cases, 62 deaths as of April 3rd.
Looking at 125 yards.
You got me?
Yeah.
To the pin
no,
here.
I do got you.
Japan has a population of roughly 127 million people. We've got, like 40 million. So Japan is somewhat under half our population, but our deaths, 5,443, have probably gone up 10 to 20 by now. Japan, 62. They had 0 new deaths from April 2nd to April 3rd.
Great contact. Nice swing.
The Japan Times website. In Japan, everybody wears masks automatically. And with something like this going around, you wear a mask. They haven't shut down the country yet, although they're talking about and they've shut down some parks and museums and things like that.
And Luke, that's one of the things we talked about earlier, is that all the experts who said not to wear a mask, now we're saying wear a mask.
This is driving me crazy because President Trump has been championing or tried to champion hydroxychloroquine with azithromycin.
Right.
All the doctors keep saying, the guys who are out there in the front lines fighting this war, they're saying, yeah. In my hospital, we're giving it to everybody, and we're having miraculous cures.
Yep.
And the bureaucratic experts are saying, no, it's not proven. Well, I've got some statistics here, guys.
All right, Luke, we got to leave it there, but you're right. The reaction to hydrochloroquine is also one of the problems as well, and it's indicative of all of this.
Here.
Stay on the line. More of your reactions as to how we can balance the conversation with regard to opening our economy and at the same time doing our best to keep this virus from spreading. That's what we need to be doing, both at the same time. We can do it. We're Americans.
Washington's Mall, WMAL, where Washington comes to talk.
1877 Cars for Kids. KARS Cars for Kids. 1877 Cars for Kids.
Looks like you'll be in the short stuff here.
1877 Cars for Kids. KARS Cars for Kids. 1877 Cars for Kids. Donate your car today.
To learn more about our programs and to donate, go to carsforkids.com. That's Cars with a K. Pickup is quick and easy. You'll also get a vacation voucher and maximum tax deduction.
1877 Cars for Kids. KARS Cars for Kids. 1877 Cars for Kids. Donate your car today.
Also accepting
Solid
boats,
swing.
motorcycles, RVs, and real estate donations.
Now, breaking news from WMAL.
Future Speaker of the House, I hope. And he's done a fantastic job for the people of California, and also the people of California have done a fantastic job. When you look at the bump, you take a look at the bump and how they're doing out there, so I congratulate everybody out there, but I thought I'd have Kevin say a few words. So, Kevin, please.
Well, thank you, Mr. President, and I would like to thank you. I'm based in California. Governor Newsom says the work that you're doing together has been working very closely. It's been effective in California as well.
But a little chip onto the green.
Today, Mr. President, I want to thank you especially for the work that Secretary Mnuchin has done, especially for small businesses. Just today alone, I saw Bank of America had more than 10,000 loans in 2 hours. And for anybody who's in small business, I had first small business when I was 20 years old. You don't have income coming in right now. You get a loan, but for your rent, paying your employees, and paying your utilities is a grant. That's part of the CARES Act. And I think you're going to find that a lot of small businesses are going to hire people back, keep them afloat through the next 2 months, and get this economy moving again as we get through this virus. So I just want to thank you for all that. Great job again. Thank you. Thank you. You go ahead. I'll talk to you later. All right.
Okay, thank you very much, everybody. And I want to start by saying that our hearts go out to the people of New York as they bear the brunt of the coronavirus pandemic in America. That seems to be the hot spot right now, but you have some others, as you know, that are very, very bad, very bad. Louisiana is getting hit very hard. Parts of Michigan are getting hit very, very hard. New Jersey is surprisingly, it's much greater than anybody would have thought. They're doing a really good job. Governor's doing a really good job out there. New York's first responders, EMTs, doctors, nurses are showing incredible courage under pressure. They're the best in the world. We will take every action and will spare no resource, financial, medical, scientific. We will not spare anything. We'll get it back into shape. The Empire State, the governor's doing an excellent job. They're all working very hard together. At the request of the governor, as you know, the Javits Center, we have 2,500 beds, and we're going to allow that to be a system where this horrible disease can be looked after, the patients can be looked after. That was going to be for regular medical problems such as accidents. And, you know, it's very interesting. The governors tell me we don't have too many accidents and very few people driving. So we're going to put that facility into play, which is a big facility. The ship will be staying the way
where
it is.
You should be.
We're putting that facility into play to help them.
That one.
And today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time. But this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people who are working so hard.
Card after that one,
doing some job.
After the handicap adjustment.
Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. A lot of things I think are going to spill over. Shaking hands maybe will stay with our country for a long time beyond
I think
this.
You might have hit a tree there.
One of our great doctors was telling me that, as you know, we have flus every year, and the number of people killed by the flu is very substantial. It said that if they didn't shake hands, that number would be substantially lower. So maybe it'll stay. Maybe some of these things long-term will be good. But those guidelines are still the best and the safest way to avoid the infection. So with the masks, it's going to be really a voluntary thing. You can do it. You don't have to do it. I'm choosing not to do it, but some people may want to do it, and that's okay. It may be good. Probably will. They're making a recommendation. It's only a recommendation. It's voluntary. We're also taking action to ensure the cost of no barrier to any American seeking testing or treatment of the coronavirus. The largest insurer nationwide, the Blue Cross Blue Shield system, has now announced that it will not require any co-pays, which is really something. That's a tremendous statement, from patients of the virus treatment for the next 60 days, similar to the commitments of Cigna, Humana, Anthem. Those are great companies, and they're all doing the same thing. So co-pays for them to do that is
Okay, let's see what you can do with this 8-footer.
Today I can so proudly announce that hospitals and healthcare providers treating uninsured coronavirus patients will be reimbursed by the federal government using funds from the economic relief package Congress passed last month. So that was as per the question yesterday and actually the day before yesterday. This should alleviate any concern uninsured Americans may have about seeking the coronavirus treatment. So that's, I think, answers the question pretty well and very much in the favor of our great people. I'm also signing a directive invoking the Defense Production Act to prohibit export of scarce health and medical supplies by unscrupulous actors and profiteers. The Secretary of Homeland Security will work with FEMA to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them. But we've done really well with the purchase of items, and you'll be hearing about that shortly. We've already leveraged the DPA to stop the hoarding and price gouging of crucial supplies. Under that authority, this week the Department of Health and Human Services, working with the Department of Justice, took custody of nearly 200,000 N95 respirators, 130,000 surgical masks,
still a little work to do,
600,000 gloves, as well as bottles, many, many, many bottles, and disinfectant sprays that were being hoarded. All of this material is now being given to healthcare workers. Most of it's already been given out. And we've given a lot to New York, a lot to New Jersey, a lot to other places. In addition to ensure that healthcare workers in New York have the protective equipment they need, the federal government, in the name of the Department of Defense, is providing about 8.1 million N95 respirators, Department of Defense, and we've already given 200,000 of them to New York City. Mayor de Blasio needed them very badly, so we got them to Mayor de Blasio in New York City. They were very grateful. 8.1 million, and we're going to be increasing that number from 8.1 million to more. That's a lot of N95 respirators.
And after that,
today my team spoke with the CEO of Ochsner Health and the CEO of LCMC, the two largest health systems in New Orleans. They said they feel that they currently have enough ventilators. I think a lot of people are going to have enough ventilators and masks and appreciate what we did and all of the things we've been doing with them, working with them. The CEO of Ochsner, Warner Thomas, who's really been fantastic, I have to say, indicated a need for 230,000 surgical gowns, and I instructed FEMA to deliver them tomorrow, so they'll have the 230,000. That's Louisiana, New Orleans. 230,000 surgical gowns. They'll have them by tomorrow. We're expanding the role of the armed forces in our response.
Okay, so you're in the rough here.
Because no one is better prepared to win a war than the United States military, and we are in a war. The invisible enemy, remember. Over 9,000 retired Army medical personnel have answered their nation's call and are now supporting field hospitals and medical facilities all across the country, like what I just told you, that Governor Cuomo requested we do something in Javits where we take it over, and we're going to have that manned by the military, because it's very tough to get people, more people in the New York area, so we're going to have it manned by the military. Javits Center. National Guard members have been activated to help states build new treatment centers and assist in the seamless distribution of medical supplies. That includes National Guard. The National Guard is assisting very strongly because the states were, in many cases, unable to have the delivery capability from warehouses and other places that we put the supplies. So I've given approval to use the National Guards, the various National Guards in the different states, and they're doing a fantastic job of not only protecting people but delivering material. The Army Corps of Engineers has assessed more than 100 facilities in all 50 states and is rapidly building temporary hospitals and alternative care sites in many states, in New York, New Jersey, Michigan, Pennsylvania, Arizona, California, Colorado, Florida, Illinois, New Mexico, Oregon, Washington, Wisconsin, Ohio. They're doing a lot of work, and just those states plus additionals that will be announced probably tomorrow, but they're doing some job. The Army Corps of Engineers, what a job they're doing, and FEMA, what a job they're doing. As we deploy the power of our military, we're also deploying the skill of our doctors, scientists, and medical researchers. We continue to study the effectiveness of hydroxychloroquine and other therapies in the treatment and prevention of the virus, and we will keep the American people fully informed of our findings. Hydroxychloroquine, I don't know, it's looking like it's having some good results. I hope that would be a phenomenal thing, but we have it right now. In approximately now, it's increased to 1,500 people. I spoke with Dr. Zucker in New York, terrific guy, by the way. We're doing a good job. And I spoke to Governor Cuomo last evening and this morning about it. So it's been there for about 3.5 days, but I think, and in many other places it's being tested too. And we have a tremendous supply of it. We've ordered it in the case that it works, and it could have some pretty big impacts. So we'll see what
where
happens.
You should be, even par.
My administration is also working to get relief to American workers and businesses in day one of the Paycheck Protection Program. As Kevin said, more than $3.5 billion in guaranteed loans have been processed to help small businesses keep their workers employed during the unprecedented time, And Bank of America has been incredible. Of the big banks, Bank of America has really stepped forward and done a great job. And then you have the community banks, your smaller banks, and we're already at $3.5 billion going out to incredible people. But that's way ahead of schedule. The SBA and the Treasury are working around the clock, and our banking partners are really incredible. And they're ensuring that the money gets to small businesses as quickly as possible.
And we were right around
225
yards out here.
Take care of employees that they would have had to let go, and now they'll keep them. And that's good. And then they're going to open for business, and they're going to have their employees, and we'll try and get back to where we were. Eventually, we're going to supersede where we were. The energy industry has been especially hard hit in the crisis. This afternoon, I met with Greg Garland of Phillips 66, Dave Hager of Devon Energy, Harold Ham of Continental Resources, Jeff Hildebrand of Hillcorp Energy, Vicki Hollab of Occidental Petroleum, Mike Summers of the American Petroleum Institute, Kelsey Warren of Energy Transfer Partners, Mike Worth of Chevron, and Darren Woods of ExxonMobil. I informed them that we will be making space available in the Strategic Petroleum Reserve to let American producers store surplus oil that can be sold at a later time. There's a tremendous abundance of oil, primarily because of the virus. The virus has just stopped demand of everything, including oil. So we're working with our great energy companies. These are great companies. They employ tens of thousands, hundreds of thousands of people. And they've kept America really going for a long time, and no big price hikes, no big anything. I mean, they've just kept it going, and now they got hit. But with all the jobs and all of the good that they do, we're going to make sure that they stay in good shape. America is engaged in a historic battle to safeguard the lives of our citizens, our future society. Our greatest weapon is the discipline and determination of every citizen to stay at home and stay healthy for a long time. And we want them to stay healthy for a long time. So stay at home. This is ending. This will end. You'll see some bad things, and then you're going to see some really good things. And it's not going to be too long. We will heal our citizens, and we will care for our neighbors, and we will unleash the full might of the United States of America to vanquish the virus. And with that, I'd like to ask Mike Pence to come up, Vice President, say a few words, and we'll have a couple of other quick talks on a couple of subjects, and we'll take questions. And it's a beautiful Friday in Washington, D.C., and our country's a great place, and we're getting better. We're getting better very quickly.
All
this
right,
was
so
artificially induced.
We
just said, they said, close it down. You have to close it down. We closed it down.
Let's haul off.
And we're healing, and we're going to get it better
fast.
fast. So, Mike, if you could come up, say
You're listening to the President's Coronavirus Task Force briefing on 105.9 FM WMAL.
The President just outlined a number of the decisions that he made today on the unanimous recommendation of the White House Coronavirus Task Force. In addition, some good news. Dr. Deborah Birx will reflect on a moment in some of the areas across America where we see evidence that the mitigation efforts, the American people putting into practice the President's coronavirus guidelines are having a positive effect. In fact, today, California and Washington State, where the coronavirus first emerged in our country, the cases remain at a steady but low rate. And we know, as Governor Newsom said yesterday, that they're not out of the woods yet. We continue to flow resources. But we want to commend people in those states and all across the country who are putting into practice the social distancing and all the measures that state and local leaders are advising and that the President has been advising in the coronavirus guidelines for America. We're also continuing to track significant outbreaks in New York State, New Orleans, Detroit, Chicago, and Boston. And as the President indicated, we're prioritizing resources to support healthcare workers and to support those that are dealing with the coronavirus in those communities. On the subject of testing, now more than 1.4 million tests have been performed across the country.
Some sand here.
And as you all are aware, some 266,000 Americans have tested positive for the coronavirus. Abbott Instruments, which now can perform a 15-minute test across the country, have literally 18,000 of their machines across the nation today. But at the President's direction, FEMA is acquiring over 1,200 more machines to distribute to every state public health lab in America and also to our Indian Healthcare Service. And the big news, of course, over the last few days was that the FDA, once again in near record time, has approved an antibody test developed by Celex. And we're continuing on the White House Coronavirus Task Force to examine ways that we can scale up these rapid tests and these innovative new tests, not just to meet this moment, but to lay a foundation for testing across the nation in the months ahead. As the President mentioned, he met with energy executives today and continues to engage with leaders of businesses all across the nation. We also held a teleconference today with commercial retailers. On the President's behalf, we thanked them for the way that people that operate malls and shopping centers around the country have embraced and enacted the coronavirus guidelines for America. It's had enormous impact on their businesses and their industries. But
this is a beauty.
I heard from them their patriotic commitment to put the health of their associates and their customers first, and it was deeply inspiring. On the subject of supplies, the President detailed our work in that
about
space.
185 yards left to go here.
Part of our air bridge, we had a flight arrive from China today to Columbus, Ohio. We continue to work each and every day watching the data about cases to ensure that, in particular, not just the personal protective equipment is available for the healthcare workers that are on the front lines, but also that ventilators are available. As this epidemic makes its way through regions and communities, we are literally working hour by hour, day by day, to make sure that patients, families, and healthcare providers have the equipment and the support.
You're on the green with
as the President mentioned, we've seen over $1.5 billion in loans go out through the Paycheck Protection Program today. We have available for questions the head of the CDC today to speak about the new guidance on cloth face coverings. And Secretary Azar, in a few moments, will explain just how the President's decision to make sure that no American will ever have to worry about paying for testing or for coronavirus treatment I'm pleased to report at the President's direction, Medicaid and Medicare already expanded to coronavirus treatment and testing early on. And, of course, the President just indicated how major insurance companies across the country are not just waiving copays on testing, but they're now waiving copays for at least 60 days on any coronavirus treatment. But now, as Secretary Azar will enumerate, and now we'll make sure that any American, even those that have no insurance, will be able to receive treatment in a hospital and never have to worry about the bill. I just give a gentle reminder to every American, if there is evidence across the country that you're putting into practice.
All right, 2 under is your adjusted score after that hole.
For America. Every American has a role to play.
Okay, it's time to send this ball on its way.
And all of the American people for the way that you're stepping forward, you're engaging in the social distancing and doing the things that will slow the spread. We encourage you to keep on keeping on. We will get through this, America. We will get through the coronavirus to that day of renewed health, renewed prosperity that the President always describes. But we'll get through there sooner, and we'll get through there when we work together.
You're listening to the President's daily coronavirus briefing on 105.9 FM WMAL.
Mr. President, thank you for your words of discipline and determination. I guess that really describes what we're asking every American, to really be disciplined about these guidelines and really determined to stay in that space of execution. You know, we are just in week 3.
All right, and we are about 160 yards or so.
We really do appreciate the work of the citizens of California and Washington State, because we do see that their curve is different. Their curve is different from New York, New Jersey, and Connecticut. And we really believe that the work that every citizen is doing in those states is making a difference, and it will make a difference for the frontline healthcare providers. We also are deeply grateful that despite the way their curve looks today, they continue to get ready for a different potential so that they can ensure that patients, if they do get sick, have options and availability. To all the frontline healthcare workers in what we have referred to as hot zones, areas where the number of cases are quite significant, the New Orleans, the New York City metro area, including New Jersey and Connecticut, the incredible work that the frontline healthcare workers are providing. We're really working now at a much more granular level, talking directly to hospitals to ensure that they have the supplies that they need in coordination with state and local governments. And to work, I think we discussed it yesterday, but I think it was quite clear also and reiterated by Governor Cuomo today that we have to support one another as each of these different
2 under is your adjusted score after that hole.
And other areas move through their peak of new infections.
12th hole coming up.
When we talked
Take
about
your best
it
shot.
at the beginning of this week, we talked about this week and next week being incredibly difficult. And we want to recognize the number of Americans who have lost their lives to this virus and recognize the sacrifice that healthcare providers are making both in their care, but I think I'm very uplifted by hearing their messages to families and their compassion for others to provide that kind of support to the individuals.
I think this is going to need to bite.
We continue to watch, in addition, the Chicago area, the Detroit area.
Nice, ended up just fine after that shot.
Have some developing concerns around Colorado, the District of Columbia, and Pennsylvania. So as you can see, each of these will follow their own curves. We'll be getting more and more of those case over time information in a very granular way to each and every one of you so that we can follow these epidemiologic curves as each of these states, counties, and communities move through this together in solidarity, and really ensuring that we can move supplies creatively around the country to meet the needs of both the frontline healthcare providers, but also every American who needs our support right now. Thank you.
Thank you very much.
Well, thank you, Mr.
All right,
President.
2 under is your adjusted score after
as
that
we battle the coronavirus. First, I want to thank all of the members of the HHS team
on the last
and
one.
the
Let's see what happens
healthcare
here.
workers across America, including those who those service workers who serve in our hospitals and our healthcare facilities, those who clean, those who deliver, those who stock the shelves, all those who are going into battle every day against the virus. Your country's asked you to serve as never before, and you have responded heroically. I'm going to provide a brief update on the administration's plans to cover the testing and treatment for the uninsured. Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured.
But
the CARES Act, signed by the President, includes another $100 billion for healthcare providers. Under the President's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates. We will soon have more specifics on how the rest of the $100 billion will go to providers. We're working to ensure that this funding is distributed in a way that is fast, fair, simple, and transparent. I'd also like to remind people that if you've lost employer insurance coverage, you have insurance options that you should look into. You'd be eligible for a special enrollment period on the health care exchanges, and depending on your state, you may be eligible for Medicaid. Just as President Trump is working to ensure that COVID-19 treatment is paid for, he's working to support new treatment options for patients. Thanks to the President's leadership, many providers are trying different experimental therapies. And we need as much data as we can collect as quickly as possible on how these treatments are working. Today, Oracle has developed and is donating to the government and the American people a web portal and platform to gather crowdsourced real-time information from providers about how patients respond to potential therapeutics. While this doesn't replace the important work of clinical trials, it gives us data rapidly. If you are a doctor or a healthcare provider and you would like to help us, you can sign up today to begin reporting on your work. There's a special registration page for providers at COVID-19.
And you're in the hole with a nice putt.
.com. Thank you very much.
All right, 2 under is your adjusted score after that hole.
Okay, let's go, Steve. If we could draw you out a little bit more on the
all right,
on
let's let her rip.
What would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk. The great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly.
Well, I guess you can't hit all the fairways.
With that being said, if somebody wants to, I mean, most people can just make something out of a certain material. So it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation. Okay?
Would you like to say something about that?
Sure. Absolutely. Surgeon General, please.
Well, thank you, Mr. President, Mr. Vice President, Mr. Secretary, and CDC Director Redfield. I especially want to thank the folks at the CDC. And it's a great question that you ask. It's a fair question that you ask. I want to unpack
great contact, nice swing,
guidance on masks, because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity.
All right, 13-footer here.
Coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission.
All right, and 1 under is your adjusted score after that one.
The Vice President mentioned this. It's critical to emphasize that
maintaining 6 feet of social distancing
remains key to slowing the spread of the virus. But CDC is additionally advising the use of simple cloth coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by the current CDC guidance. As the President also mentioned, cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. This recommendation complements and does not replace the President's coronavirus guidelines for America, 30 days to slow the spread, which remains the cornerstone of our national effort to slow the spread of the virus. CDC is always looking at the data. We've told you that from the beginning. Dr. Burke said that every single press conference. We're looking at the data, we're evolving our recommendations, and new recommendations will come as the evidence dictates. So I want to say if you do choose to wear a face mask, very important, wash your hands first because you don't want to put on a face covering with a dirty hand. Do not touch your face while you are wearing the face covering because, again, you could take materials from the surface, germs from the surface, and bring it to your face. If you choose to wear a face covering, please leave the N95 mask, the medical supplies for the medical professionals, healthcare workers, and frontline workers.
Solid swing.
Know that this is not a substitute for social distancing. And remember, this is all about me protecting you and you protecting me. This is about us coming together as communities, and if people voluntarily choose to wear a face covering, they're wearing it to protect their neighbors from getting the coronavirus because, again, they could have asymptomatic spread. So, Mr. President, thank you very much for that. Appreciate the opportunity to update everybody.
You're listening to the President's daily coronavirus task force briefing on 105.9 FM WMAL, Woodbridge, Washington.
It said that every state should have stay-at-home orders right now. Do you agree with that? Should every state in this country have the kind of stay-at-home orders that we now see in places like Washington?
I leave it up to the governors. The governors know what they're doing. They've been doing a great job. I guess we're close to 90% anyway. And states that we're talking about are not in jeopardy. No, I would leave it to the governors. I like that from the standpoint of governing, and I like that from the standpoint of even our Constitution. Please.
Mr. President, to address the shortage in the blood supply, the Food and Drug Administration announced yesterday.
Well, right?
Thanks,
we
Mr.
have
President.
I heard a different voice. I heard a much different voice. Go ahead. We'll get you later.
Going to the oil meeting previously, is the U.S. willing to cut domestic oil production? What came out of the meeting? What was the consensus?
Okay, this one's safe.
It's a great industry. It's an important industry. It's a tremendous job-producing industry. And it's just vital. And it was also very interesting because they all were given the test before they came into the room. So you have the head of ExxonMobil, you have all these guys taking the test, and they all passed with flying colors, so that was good. They left happy in that respect, at least. There's just an overabundance of oil right now, oil and gas, tremendous overabundance, and it was caused, they were doing a great job. They were producing a lot of energy, but then you had the virus come along and it knocked another 35%, maybe 40% off of the market. So there's too much oil. There's a glut. And these are great companies, and they'll figure it out. free market. We'll figure it out.
You spoke to President Putin. I mean, what's on the table here with him?
9-footer here, I think.
They were having
he can do this.
competition. We'll see how it all works out. I think it's going to work out very well. It's going to take a long time to get rid of that. There's massive excess amount of oil and gas, massive, like probably there's never been.
Good putt.
So
you're in there for bogey.
Well, I guess you could say, as for drivers, I think in certain
Even
locations,
par
it's
after
down
that
to
hole.
90,
That's your
95
adjusted
cents a
score.
gallon right now on the road. But
16th hole coming up.
A great industry, a tremendously important industry from the standpoint of jobs. And we're energy independent. We have to make sure we keep it that way. All right, please, go ahead.
Mr. President, as I was saying, the Food and Drug Administration, to address the shortage in the blood supply, announced yesterday would ease the restrictions on certain donors, including gay men, who are now required to be abstinent for 3 months as opposed to 12 months to donate. Did you have a hand in that change?
No,
Someone's
I
going to
didn't
need
know
to bite.
anything about that. That was done by the FDA, very capable people at the FDA.
Yes, Mr. President, both the government of Canada and 3M are pushing back on this DPA not to export N95 respirators. 3M says...
I don't blame them. They can push back if they want. We're not happy with 3M. We're not happy. And the people that dealt with it directly are not at all happy with 3M. So we'll see whether or not we do. I heard what he had to say today. I don't know the gentleman, but we're not happy with 3M. Go ahead.
And where is Dr. Fauci?
I don't know. But every time you ask that question, whenever he's not here, you look. You say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him to come because that's the first question that you and a couple of others from the fake news establishment ask is, where's Dr. Fauci? We're doing great together. We're covering a different subject today. Go ahead.
Different subject.
Go ahead, Jim.
Mr. President, you have said nobody could have seen this pandemic coming. But in fact, Secretary Azar at a biodefense summit in April 2019 said, of course, the thing that people ask, what keeps you most up at night in the biodefense world? Pandemic flu, of course. I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had the potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Well, I always knew that pandemics are one of the worst things that could happen.
1 under is your adjusted score after that one.
Probably 1917. That was the big one.
Coming off
Europe
a par on the last one. Let's see what happens here.
Probably. I've heard about, excuse me, wait a minute, let me finish. I've heard about this for a long time, pandemics. You don't want pandemics. And I don't think he was talking about a specific pandemic. He was talking about the threat of a pandemic could happen, and it could happen. Most people thought it wouldn't, and most people didn't understand the severity of it. This is very severe. What's happened is very severe. But I'd let you answer that. I assume that he was talking about the concept of a pandemic.
Thank you, Mr. President. Absolutely, for 15 years now, this country is at a massive...
Nice. Should be in the fairway.
...state and local level of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic
and
flu
about 135 yards out from here.
We knew about MERS, which were earlier modifications or variants of the coronavirus. None of those achieved anything like what we're seeing today. But that's why for successive presidencies, including the leadership of President Trump, there has been a great focus on pandemic preparedness. In fact, it was just in November, I believe, that the president signed the Pandemic Flu Preparedness Executive Order. That we
great contact.
We have also updated the Pandemic Crisis Action Plan, which has been the playbook from which we've been working, the Pandemic Flu Plan, the action plan from which we have been working that coordinates the whole of government, whole of economy approach here. So we've all been very focused on pandemic preparedness. That's what we do. But this particular strain of pandemic, who would have known this particular strain?
But Secretary Azar, if you were preparing for a pandemic, if this government were preparing for a pandemic, why is it we don't have enough masks? Why is it we don't have enough medical equipment in this country?
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it. You know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question, because the shelves were empty. And you know what else? The military shelves
one
were
under
also empty.
after that hole. That's
we had no ammunition,
score.
literally. And that was said by one of your favorite generals.
Okay, here we go.
We have no ammunition. Guess what? We had very little medical supply also. All right. Go ahead. We'll get it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead.
So I wanted to ask about the DPA. So you said that there will be a ban on exporting of all, what does it cover? So masks, gloves, what else is included in that order? And are you concerned?
But if somebody ordered, if Italy, if Spain, who has big problems, these are countries with tremendous problems, France, if they have long-term orders and they're in there and they want to get certain things, I've let them go out in certain instances because I think it's only fair. They have problems that are proportionately or relatively bigger than our problems. So if they ordered something and they're waiting for, as an example, masks made here and going to Italy, I'm not going to be stopping that. I think it would be very unfair.
And
by the
you
way,
were
speaking
about
being fair
150 yards
two
from the
very
pin,
big
I'd
cruise
say.
liners, as you know. I allowed them to dock today. We worked with the governor of Florida, as you know, Ron DeSantis, and we worked on it, and we had tremendous security, and we took the sick people, and we're working with them. We have doctors. We have great doctors, military doctors. And from a humane standpoint, not that we're in love with this. These are two massive ships, but we have to take care of people. We have to take care. We sent many back to Canada. The Canadians came and worked very closely with us, as did the UK.
All right, you are on the green. You can putt for the bird.
We took care of the Americans. We took care of the sick. We had some people very sick. I think we had 3 to 4, maybe 5 people that had died on the boat. One of the boats, actually, and we had to take care of these people, so we could have let them float aimlessly into the ocean looking for port, as they've been doing for a long time, and I made the decision we had to take them in, and Homeland Security and a lot of other people did a great job, but we had to help people. These are people that were very, very sick. Some were dying, some died. Please. Go ahead. Yeah, go ahead.
Mr. President, your staff today said that people close proximity to you and the Vice President will get a coronavirus test. I'm wondering, are you concerned?
All right, and at the end of this one, he's sitting at 1 under par.